It is 5:24 now, and we're turning to health news. It is a highly contagious respiratory infection. Cases of pertussis, more commonly known as whooping cough, have steadily gone up in the U.S. over the last few decades.
Yeah, and in today's Mom Squad, we have tips to help protect your kids. Dr. Camille Sabella is with Cleveland Clinic Children's Hospital. He says the disease is highly contagious and can spread quickly. Because of that, infants under the age of 1 are at the greatest risk because their immune system is still developing. He says that babies may not have the telltale coughing symptoms that others get with whooping cough.
They can present with choking episodes, gagging when they feed, turning blue, stopping breathing.
Dr. Sabella says vaccination is the best defense. Whooping cough vaccines are combined with other vaccines. Pregnant people should also get a booster dose to protect babies until they're old enough to get the shot.